Hello, everyone. Thank you for joining us for the BPAC meeting. If all the BPAC council members could please put their cameras on if they are able to. And Madam Chair, are you in the meeting?
Hi, everyone. Yeah, this is Anna Binder. Okay, there we go. I was disabled. Okay, there we go. Good morning, everyone. Is Ariana here? She did shoot me a quick message that she was running behind.
Oh, okay.
So we can just, do we have quorum?
It looks like we are working on getting everyone's cameras and microphones enabled for the BPAC members. So if it's not yet, it should be momentarily. Anna, let me count the members. I only see 2 cameras on. Okay, I see Gina.
I see a bunch of hands up. Do you guys have questions, or are you just pointing out that you're still disabled in some way?
Okay, I show Ariana is here.
Members were asked to raise their hands so we could be counted for quorum. That's why my hand is raised, but.
Okay. It looks like we may have 9. I think we have 9, which would be quorum. Chair Saunders, can you hear us?
Jennifer, she might be with us, but she, like I said, she is taking care of something else at the moment. So she said to just go ahead and get started.
Anna, would you like to sit in as chair?
Until she joins us in actual participation, sure. Okay, since. Oh.
Can you hear me?
Yes, we can.
Sorry, I'm trying to join by my audio. Sorry, it's a travel week for me.
No
okay.
worries.
Welcome, everyone. Yeah, so did we do roll call? Sorry, goodness.
Not yet.
Okay. You want to start with roll call?
Perfect. All right. Anna Binder.
Present.
French Steffanone. Sarah Dearborn.
I'm here.
Dr. Krista Hales. Lori Kears. Dr. Pearl Kim. Ariana Saunders.
Present.
Jania Germa.
She's here. Give me 1 second. I'm allowing her microphone and her camera.
I'll mark her as present. Drew Skeen,
Present.
Allison Wall, Isabella Tran,
Present.
Michael Galper,
Present.
Montana Miller, Lauren Wynn,
Present.
Tiffany Bearden,
Present.
Jamie Ross,
Present.
Franklin Morris, we have 10 present, and that is a quorum.
Lori Kearse has arrived to the meeting.
Did someone say something?
Lori Kearse is present.
Okay, I will note that. Thank you.
Thank you. And I just want to go over one thing that you may not, or you may see across. You are not able to remove yourself from mic or camera unless you are a council member. If you need access or would like to speak up during anything, I will need you to raise your hand and I will allow you to bring yourself off of mute at that time. The floor is yours, Ariana or Anna.
Thanks, Sierra. All right, so we'll officially call this meeting to order at 11:10 a.m. First order of business is our public comment. Just as a reminder to folks, no action can be taken upon matter raised under public comment unless this matter itself has been specifically included in an agenda item. As an action item, to provide public comment by phone, you can dial in 775-321-6111 and enter the conference ID 930610-427 pounds. Comments are going to be limited to 3 minutes per person. Please, persons making comments will be asked to begin by stating their name and to spell your last name for the record. With all that, do we have anybody who wants to make public comments? Okay, I'm not seeing any hands raised, so I'm just going to keep us moving. Just a reminder for all council members and guests, you have the opportunity to make public comment towards the end of the meeting. So packed meeting, so I am going to keep us going. First, sorry, hard to get this screen to maximize so I can read. First, so the next agenda item is approval of minutes for review and consideration of our January 5th Behavioral Health Planning and Advisory Council meeting minutes. Council members should have got those minutes emailed to you all. Any questions, comments, or corrections for those minutes? Hey, Michael.
This is Drew Skeen. I missed the last meeting, so I won't be voting.
Okay, thank you, sir.
And this is Michael Galper. I noticed that my name is not in the present, although it's throughout the minutes for when I talked, but it's not listed as in the present.
Okay,
It
thank you,
almost
Michael.
it almost looks like there was a cut and paste of a list, so check to see if anybody else was cut off.
I was going to make the same comment. I believe all 4 of the new members, 3 of which were present, according to the minutes, did not make it onto the present list.
I will take a look at those and get those corrected.
Thank you, Tara. Any other corrections or comments? All right, so if we make those corrections, updating members to be present. It's everything option.
This is Sarah Dearborn. Pending those corrections, I make a motion to approve the minutes with those corrections.
Thank you, Sarah. Any other
I can
further?
second.
Oh, okay,
Lauren
sorry.
Wynn for the record. I'll second.
Thank you. Any discussion? Further discussion, I should say. All right. If not, all those in favor, please raise your hands. All right, I see 9 hands raised, 10. Second, all right, clicks can lower their hands. All those, anybody opposed? And then hands, and any abstentions? I know we have one. It's 2, Isabel. Drew. All right, with that, motion carries. Everybody? Keep it moving on to agenda item number 4. We have council member updates and introductions. Somebody correct me if I'm wrong, but I think all most recent additions have been introduced. Is there anybody, council members who've joined us, who've not yet had the pleasure of giving a little 3 minutes introduction to your and your fabulousness? Yes, Jamie.
I believe that the 3 of us of the 4 new members who were here at the last meeting all introduced themselves, but if the 4th member, who I don't know who they are, is here, they can introduce themselves.
Thank you.
Hi, everyone. My name is Montana Miller, for the record. And I am filling the role of the person with lived experience. So I live in Northern Nevada in Reno. I'll have 13 years free from the use of opioids in 2 weeks, actually. And I now work as a marriage and family therapist intern and licensed alcohol and drug counselor, really specializing in addiction in the family system. So I'm excited to be a part of this board. Thank you.
Excellent. Thank you, Montana. Excited to have you. All right. Also, this agenda item is open for any other board members if you have any board updates that you want to share with the board. Anything related to our work. Scope of work. News coming up from the agency, anything. I will keep it moving. Not trying to be rude, but we do have a packed agenda, so come off mute and yell at me if I miss a hand. Okay. I will close that agenda item number 4 and open up agenda item number 5. This is going to be a presentation from the Bureau of Health and Wellness Prevention to talk about a couple of new legislative or new regulations that are being proposed. So I believe I turn it over to Shannon.
Hey, Ariana, thank you so much. Yes. Good morning, everyone. Tiara, would you mind helping me with my slides?
Good to go.
Thank you so much. Good morning, everyone. I think I know many of you, but my name is Shannon Bennett. I'm the Bureau Chief here for the Bureau of Behavioral Health, Wellness, and Prevention. Pleasure to be with you this morning. So we had recommended to our advisory council that we share with them our proposed regulations and what our intentions are for this interim. So we put together a couple slides, nothing too crazy, intending to give a high-level overview. As we're in the very beginning stages of this, we have everything drafted and we've been having lots and lots of community conversations even before they went to LCB. And we intend to do that as we go into our public workshop phase of the process. So go ahead and go to the next slide. Just a little bit about DPBH, our mission to protect, promote, and improve the physical and behavioral health and safety of all people in Nevada equitably and regardless of circumstances, so they can live their safest, longest, and healthiest and happiest life. Our vision is a Nevada where preventable health and safety issues no longer impact the opportunity for all people to live life in the best possible health. And our purpose is to make everyone's life healthier, happier, longer, and safer. So that's us here at the Division of Public and Behavioral Health. So as I mentioned, we want to go over what are regulations, because I think some of that language may be a little bit new to some folks. We want to give a high-level overview of what we're proposing, why, and then our timeline, and then I'm happy to talk about anything that anyone wants to talk about. So go ahead and go to the next slide. So what are regulations? Basically, they are our Nevada Administrative Code. They are intended to get more granular than the Nevada Revised Statute does. So they interpret, clarify, or give procedures for carrying out state laws. They are adopted by state agencies typically, and they have to go through a whole certain public procedure in order to be approved. We have authority to adopt regulations for specific purposes, and that is provided to us in statute. And we are using these two statutes that I listed below, NRS 458 for the alcohol and other substance use disorders, and then NRS 433 for mental health. And you'll hear me talk a little bit about that. What we're really trying to do and what we're really trying to set the structure up is to get them to weave together, because as we all know, who work in this field, humans don't live in one silo or another. We are very much a whole person that has lots of different things going on. And we want, now policy is often more black and white, unfortunately, but we want to make sure that those two things knit together. So you're going to see a little bit of the language that we're trying to incorporate to get that to happen. But NRS 433 is going to be more mental health, and 458 is going to be more substance use, although everything is set up to be co-occurring as well. Can you go back to the previous slide real quick, Tiara? Make sure I got everything. Yes, and they have the force of law once properly adopted. So they go through a whole process, which I'm going to go through here at a very high level for you all in a couple slides. Go ahead and go to the next slide. Okay, so the nuts and bolts of this, what we are working to do in NAC 433, so the mental health chapter, we are working to create certification of certain behavioral health programs as defined by the division. That is going to allow the adoption of division criteria, which is going to be a sub-regulatory guideline of the regulations that's going to set out the standards of care and the best practices. And that includes an approval process for the division criteria, which is actually this wonderful council that we have in front of us today. So we will bring all division criteria changes or creation to this council, and there will be a public process for that as well. We are tying funding to certification. So in order to get state federal funds or Medicaid reimbursement, we tie that to the certification. It establishes the process for certifications, the fees, applications, requirements for the operators. We mirrored this off of NAC 458 because that is our substance use regulation. We already have authority and we already have the structure, the bones there to do this in 458. Now we're mirroring that for mental health. These regulations define certain behavioral health programs, so it defines and other pertinent terms. So at a high level, and really encourage you all to read these, but it defines ACT, Assertive Community Treatment, Certified Community Behavioral Health Centers, mobile crisis teams, although they're already defined in statute, first episode psychosis programs, and something that I'm missing, crisis stabilization centers, but that's also already defined in statute, at least some of them are. The intensive crisis stabilization services, which is more what is more of an outpatient basis that Medicaid has adopted for this dual, two different options to seek Medicaid reimbursement for those centers. So we set that language up to be either tied to a hospital licensure or for the outpatient. So you'll see that there. So it defines those specific programs. We add training requirements for the certification. So in order to be certified, there's going to be training requirements that will be set in division criteria. requires participation in a centralized bed registry system for certified providers. So this is the glue that holds everything together. Our bed registry system right now is Open Beds, and we will be transitioning here in the coming months, and you're going to be hearing more about that as we go through the summer, to Carillon's platform, our 988 vendor. And this is the glue that holds everything together because it really shows us where there's open beds, where there's availability, and what the wait times are in order to get to these different things. So it's a really good pulse on what's happening within our provider community and where to get help quickly. And this also it also restricts the use of certain language regarding crisis stabilization centers. So we basically don't want certain terms to be used, like mental health urgent cares or crisis stabilization or anything like that, to be used by anybody who isn't an actual certified facility. So that's 433 in a nutshell. Again, I'm going very high level here. 458 is a little bit of cleanup and a little bit of change, really to strengthen our access to care. So it adds our recovery programs. We actually, this body approved our recovery housing division criteria a couple, maybe like 6 months or so ago, or maybe a year ago. Time goes so quickly. This is just adding recovery programs into the regulations to match. It revises care plans of care, which is the plan of care that is an option for moms to opt into when they're in the hospital and have a baby born, if they are an opioid user. It defines co-occurring disorders, which you're going to see the same definition in 433. It modifies the substance use disorder definitions. It expands telehealth and problem gambling endorsements. So during our strategic plan, one of the big things that came up was access to care as a problem, which I'm sure is not news to any of you. So we're looking at ways to strengthen our ability to improve access in that via telehealth, because that was one of the key recommendations there. It modifies language to require certification for Nevada Medicaid reimbursement. Again, with the training requirements, this is for the substance use side of the house. Requires participation in a centralized bed registry. So the same conversation that we had with 433, this is in 458. It defines requirements for mobile services. Same thing here. A lot of our providers, and one of the best practices across the country, there's a lot of interest in doing mobile services, and we just need a way to capture that. And then it adds requirements to align with the DEA for our opioid treatment providers. Go ahead and go to the next slide, Tiara. So why? All of these things work to set standards for certain behavioral health programs to ensure Nevadans are receiving high fidelity care. It also works to better coordinate the care within the system itself. And we are also striving to enhance opportunities for care. Go ahead and go to the next slide. And our timeline. So we wrote the initial draft and we sent it to LCB, the Legislative Counsel Bureau, for official drafting. So we are not lawyers. We are not professionals at drafting all of these things and thinking about all of the different things to cross-check. Excuse me. So, but LCB is, the Legislative Counsel Bureau is. So we wrote them with our best intentions put forth, and now we're working through it with LCB. So you're going to see another draft hit the registry here in the coming months, and then we're going to have a public workshop. So right now, LCB is drafting. We have lots of cleanup to do with them, lots of legal stuff to work through. So we're doing all of that. In spring to summer 2026, we're going to have public workshops, and we're also going to have to do a small business impact survey and address or discuss with the people who have any concerns what those concerns are. And then we'll have to report back out on that. In the fall of 2026, we will have a public hearing, which is our Board of Health or the administrator. So it depends on which regulation we're talking about here. They have different requirements. For our crisis regulations, they go through our administrator, and for some of the other ones with 458, and then some of the other pieces in 433 have to go through the Board of Health. And then in winter 2026 into 2027, we will take these to the Legislative Commission for the final approval. And then in early 2027, we will begin certifying new programs. And that will be a slow roll too, as we move forward with that to make sure that we're doing everything appropriately. And I think that's my last slide, but I am happy to take questions as you have them.
Excellent. Thank you very much, Shannon. All right, I'm looking to my fabulous board members. Do we have any questions? Yeah, Sarah.
Hi, Shannon. Thank you so much. I appreciate it. Can you remind me where the specific drafts live? Like, are the drafts posted, or is that all kind of under the radar for now until it comes to that public workshop?
Yeah, thank you for the question, Sarah. Appreciate it. So if you, and I believe we set the links out, but I think they broke when we sent the listserv out. So we will resend them later today if they haven't been sent already. I know it was on our radar. But when I look for them, I just Google Nevada Register, and then I find the LCB's website. And then I go to 2025 because that's when we submitted them to the LCB. And I look up the two NAC numbers that I'm looking for, the two chapters. So 433 and 458. And you can find them there. So that's my quick tip, but we will absolutely send the appropriate links out. If they haven't been already, we will send them after this.
And Anna.
Thank you. And thank you, Shannon, for this. I'll go look all those up because I don't think I'm on your listserv. But and then the workshops go out on the listserv too, right?
Absolutely. Thank you for the question, Anna Marie. Yes, workshops, everything will be on the listserv. And again, you know, we presented this to the 988 Coalition. We've brought this to the CCBHC group. We're trying to get in front of everybody that is possible, we can possibly get in front of. We want to talk to everybody. We want to hear the concerns and the questions and try to get some of that before even the public workshop. But again, there will be a huge public process here, as I outlined through all of that as well. But if you have questions now, like reach out to us because we want to talk.
Yeah, I'm gonna have to go, look at those things. But could you guys, for maybe our newer members who aren't on the listserv, can someone, what do? Do they just send Tiara an email, or can you guys drop the email to request that into the chat?
Thank you, Anna Marie. Shannon Bennett for the record. We should be automatically adding them. I know we have been doing that historically, so if you're not getting them, there's just some weird little glitch. But yes, we do review all of our certified providers, and we update the listserv with that list, as well as our board members. And then if there's anybody else, they can subscribe, of course. Our sub-awardees are often part of the listserv too. We automatically add them.
Okay, great. Thank you. I mean, as you guys know, I do support strengthening our standards and improving coordination. I guess I just want to ensure that, as always, any of our implementation doesn't unintentionally reduce any type of capacity or restrict access, especially in the rural and Medicaid dependent communities. So are the business impact findings, are those going to be available before the public workshop?
Absolutely.
I see.
Yep.
Okay. I see
Yep.
you shaking your head. Yes.
Yeah.
Okay. Awesome.
Yeah. Thank you for the question. Absolutely. And we don't either, Anna Marie. Like, we go into these things and we have the best of intentions, and you're exactly right. Like, you poke over here and you don't know what the repercussions are going to be over here, right? That's just the natural consequence of the way these things work. So we're working to understand all of that, and that's why we want to talk to everybody. So come talk to us. Like, we want to have the conversations. It helps us. But then, yes, to your point, we will have to do the small business impact survey, which is going to reach our providers. That will also go out on our listserv. That will reach our providers, and then we have to compile it all and put it into a nice, pretty report, and then that will also be shared publicly and discussed at the hearing.
Okay, just one more, Madam Chair. because I'm really interested in the telehealth, mainly because of what's going on at the federal level versus what our local level is and has been holding on to. And I really appreciate all of our departments in every capacity as they're working to maintain a strong telehealth system. So have we heard, well, because of the Samsha snafu, the magical reversal, since that fiasco, we haven't heard anything negative about funding for telehealth services.
Thank you for the question, Anna Marie. This is Shannon Bennett. For the record, no, I haven't. I haven't heard anything. In fact, we've done a lot of research nationally, and it's very well supported. And that's why we want to bring Nevada into that fold and make sure that we have the pieces in place to do that appropriately. Because obviously, we do have an access to care issue. So we're looking at ways to do that and still protect the people and make sure they have good quality care, right? But that we can allow that to happen appropriately.
And I just wanted to mention on February 24th, I sent out an email to the council with those links provided. If you guys would like me to resend them, I absolutely will. But just so we are aware, I did send those.
Thanks, Kira. Okay, any other comments or questions? In the roll for council. Yeah, Jamie.
Sorry, Tira, this is Jamie. You said you sent them out on 2/24?
Correct.
I have the agenda and the minutes from you on 2/24, but not the regs.
It came in a separate email following that one. So there should have been two emails on 2/24, one that had the agenda and minutes attached. And then the following one around 2:48 in the afternoon, I sent out an additional email with the links to the proposed regulations.
Thank you.
Not a problem.
Okay, any other questions, comments? All right, thank you, Shannon. Appreciate the update. I'll keep us moving. Oh, this is my favorite part of the time too. I get to turn over. For agenda item number 6, I'm going to turn it over to our fabulous vice chair, and a reminder who's going to walk us through some thoughts, discussions we want to have around supporting implementation of strategic plan. And I'll turn it to you.
Okay, thank you, Madam Chair. So agenda item number 6 is for advisory framework and implementation discussion and possible action. So I believe Shannon was going to hit us with a couple things from the strategic plan that we got a high level overview of at our last meeting. And then really the goal of this agenda item is to have the discussion for us to, try to come up with some type of methods and structuring for our work rooted in that strategic plan. So I'll turn it over to Shannon real quickly and then we'll come back.
Great. Thank you, Anna Marie. Shannon Bennett for the record. Tier, could you reshare those slides with me again, please? I have a couple at the end of that first deck for this discussion.
Which one is
the same one? Yeah, okay, the same one.
In AC. My computer's just loading.
Thank you. Yeah, and if you go all the way down to the bottom, I think I made 2 slides for this discussion. Yeah, 11 and 12. Perfect. Thank you.
Oops. I didn't like them.
Thank you, Tiara. Appreciate it. Okay. Thank you, Anna Marie, for the opportunity for the discussion. Yeah, what I thought I would do is just take out the strategic plan. You may remember has some cross-cutting, like overarching themes in it. Now, each subject area has its own strategy. There's a list of strategies, but these are things that touched most, if not all, of the areas. So I called them out here on the slide. Stigma reduction, peers, strengthening CCBHCs, access to care, expanding reach to the rural population, school supports, transportation barriers. And this one is not in the cross-cutting part, but it's talked about throughout the strategic plan. So it probably should have been. I added it here, integrating behavioral health into primary care. There was a lot of discussion about ensuring that no matter where the person goes, no matter where the access point is, that they have, they can be transitioned to care, that they know how to be referred, and that there can be some preliminary work done at the primary care office, or maybe it's at the emergency department or whatever that is. So I wanted to call this out here for the council to take a peek at, because I think this is where we're coming from, and this is the frame that we are coming from for the next few years. Tiara, if you go to the next slide. I also wanted to share this with the council because I think this will also help frame kind of how we're thinking about these things. So we will begin drafting our next request for applications this at the end of this year for early 2027 release. And they will only be using the strategic plan strategies. So it's going to be very project based, only using those key areas that we have deemed priority. So that's going to be for the State Opioid Response Grant, Community Mental Health Services Grant, and the Substance Use Prevention, Treatment, and Recovery Services Block Grant as well, that we're looking at targeted requests for applications for. So I just wanted to share that with the council as well. As we have these conversations, I think it will help us craft what we write into those RFAs at the end of this year. I think that's all I have to share. Anna Marie, I'm happy to talk about whatever's helpful for you in your discussion.
Okay, thank you. Well, really why we're having this discussion is as a BPAC, we have responsibilities. And now that we have fully entered into our strategic plan, we are in the interim session. We wanted to have the conversation of what work can we do as a council that will best support your implementation. I know we've already had conversations about the anti-stigma campaign. As you know, several of us, I think, are interested in helping with that work. I know in a later agenda item, we are convening the data subcommittee, which I know will align when you guys get your kind of first measurable data back from the like quarterly or whatever implementation from the strategic plan. And then, you know, also open the floor to our members of any ideas of where they think our council can help.
What might be helpful for us would be taking some of these topic areas and just having discussions about them over the next few months or whatever that looks like. That might be fruitful for sure.
I'm okay with that. Are we still on, Shannon, sorry, are we still on par to have our first round of data back before July?
Yeah, it should be around July. Our evaluation, our first year's evaluation report is being drafted right now. That will share some of the baseline data and kind of set it up for some of the next steps in the strategic plan implementation. So our vendor is working on that right now. but yeah, I think some of these things might benefit from some enhanced conversation. So I think there's opportunity there too.
Okay, great. Thank you for that. I think we have, when's our next meeting, Tiara?
May 4th, I believe.
Okay. I mean, I do know in a lot of the community meetings that I've been participating in down here, the youth are being very outspoken about access and or lack of access in schools. So I personally would really like to prioritize us talking about that. Um, so like if we grouped these together for, if we did a couple maybe on May 4th and then a couple after that, and then kind of in the interim, I think the data subcommittee would be meeting to go over that data with you. Is there, does anybody have, like if we picked, say, 2 for our May hearing, does anyone have thoughts on any conversations you'd like to prioritize for that May meeting? Jamie?
This is Jamie. I would love to see, since I'm a fairly new member, how going off of your youth conversation, I think it would be helpful to understand the intersection to the DOJ investigation and the results of said DOJ investigation and how these regulations address or don't address those sorts of things. And if this has already been covered, if someone can just send me the minutes or the paper or the video from that meeting, I will happily watch it on my own time.
Sure. So I bring up that settlement actually quite often, but this council does not have oversight of that. But we know that obviously the terms of that settlement, the state is under obligations to do things with. So, Shannon, how do you see that?
Thank you. I appreciate the comment and the question. Yeah, you're right, Anna Marie. We have been involved only in certain pieces of it. So I can speak to those pieces of it. What I was actually going to recommend perhaps would be if you want to talk about schools, we fund part of the multi-tiered systems of support out of our mental health block grant with UNR to UNR, Dr. Ashley Greenwald, and she does an amazing job really developing some of the systems for the schools, and she has a ton of data to share. So I wonder if that might be a fruitful place to start. We could invite her to come and talk to you guys. It might be a fruitful place to start for the council to hear. And then, there might be a lot of ideas that stem from that, because we've always, when we've had our planning discussions internally, we've always talked about how it would be great to utilize the MTSS data to put strategic assistance in specific communities that the data is showing is needed, right? So that might be a really fruitful conversation, Anna Marie, if that's of interest.
It would be. I actually, so for some of our new members, I'm also the chair of the Nevada Governor's Council on Developmental Disabilities. So I've been attached to the MTSS work through that lens because of the way the data is reported, at least to the state level. So I asked the new state superintendent if he would be willing to work with us and our districts to kind of make sure that the way that they're collecting the data is appropriate. So for example, they're unsure that if they capture a student of a particular ethnicity and then they're capturing a student with special education, they don't know if it's the same student or they're counting that student twice. And so as I'm sure many of you guys know, it in turn turns that data to look very disproportionate amongst all of the ethnicities and special education. So we're working on that. And then also the Clark County School District is um, they're bringing back an NTSS work group to not just kind of hit that data thing, but um, we have to improve the data. And so, regardless of what we can see from the data, they're opening that work group back up to have deeper conversations and whatnot about how to support our students down here. So, Jamie, if you would be interested in that work or anyone else on the council, let me know. It has not convened yet. They just announced it about 2 weeks ago. But I am looking for interested community partners to do that work, at least at our local and Department of Education. But Shannon, I do think that would be a good place to start with them as well, um, just so our council can become a little more familiar with that. And I think it'll really come in handy as well when we start doing the anti-stigma campaign. But I've been to about 9 of our dream sessions and our trustee community meetings over the last couple of months. And at every single meeting, the youth are there and they are completely advocating for better mental health support in the high schools, at least. That's who's showing up. So I hope that was helpful, Jamie.
And Anna Marie, I'm happy to reach out to Dr. Ashley Greenwald and see if she is willing to come present, and then we can start the conversation there. I think that'd be great.
Okay, great. And then I have Sarah and then Lori.
Great, thank you. I just wanted to respond a little bit to Jamie's question around the DOJ settlement and all the work being done for children's behavioral health. So as Anna mentioned, I think, or it could have been Shannon, I'm sorry. The Nevada Health Authority and Nevada Medicaid is really leading a lot of that settlement work. And there are some pretty consistent children's behavioral health working groups that kind of go through all the expectations of what's in the DOJ settlement. I was trying to find the next meeting. I believe they just moved their meeting cadence to every other month for 90 minutes, and it's usually the second Thursday from 4 to 5:30. And someone please remind me, I can certainly drop the link to the CBHT webpage in the chat. I just can't remember if I'm able to put that in the chat.
Sarah, if you could send it to Tiara and then she
Okay.
can circulate it to the board. Thank you.
Thank you. And I have one other just quick idea around a lot of what DPBH's work that they're all working on within their strategic plan. I love the idea of kind of sparsing it out on subject areas because it's so big. So I think having 1 or 2 subject areas would create a little bit more focus and discussion on each of the items. And then Shannon, just to offer support too, if there's some certain areas where you find valuable to add, like how does reimbursement work from the Medicaid side, just kind of including some slides or communication there. I'm happy to connect you with people working on each of those individual areas to help complete the presentation.
That's always helpful, Sarah. How's the money work? Thank you.
Actually, the DD Council, in partnership with NBHA, is hosting a Medicaid town hall. So I'll send that link to Tiara. When we get into the brunt part of the conversation, it surrounds some stuff happening with ABA therapy, but they are going to spend the front part of the town hall explaining how Medicaid and all those things work. So that work's already being done. So I don't want to duplicate it because they're putting a lot of time into that. So I'll share that with Tiara to send out for anyone who wants to get a refresher or hear newly from NBHA on that. Sarah, did you have a recommendation for another topic for our next meeting?
I heard you all speaking around the school work, and there's under the Nevada Health Authority, there's a lot of work being done on our school-based services. So not necessarily on the benefit side, but I can certainly connect Shannon to that group as well. As far as other subjects, I think all of them are awesome, so I can't really narrow it down to one. I know we're working towards improving like our peer reimbursement rates at Medicaid, and there's certainly a lot of discussion around how peers can now enroll in Medicaid as well, so that may be of interest.
Okay, great. Thank you. All right, Lori?
Yes, good afternoon. Shannon, this question is for you. I was wondering if in the data collection and review is there anything that we're doing with juvenile justice? There are some concerns within the three facilities, state facilities that we have in the state, that services may be lacking, certainly substance abuse treatment for those that have a diagnosis. And then most of all is the lack of appropriate referrals for ongoing services once they leave the facility. In addition, there's some concerns with family involvement in the treatment recovery process in the facility, as well as being followed through, once people leave. So I'm wondering, is there any research or any data being collected and looking into services that kids in the juvenile justice system are receiving?
Thank you for the question, Lori. Appreciate that. I know we do fund a project with DCFS, though. So our sister agency, the Division of Child and Family Services, primarily does most of that work. Happy to connect you so you can ask some of those questions, and then we're happy to chime in and help where we can.
Okay, great. Thank you. I'm thinking that perhaps I think it was last year sometime, we had the deputy administrator for juvenile justice present at one of these meetings, and then we never got a follow-up. So I'm wondering if we could invite Deputy Sharon Anderson back for a follow-up from our initial meeting with her. In addition, I know that we talked about also going out to Summit View and doing a review as well, our own. So I think we need to follow up with that
We
as
did.
well.
Lori, Dr. Kim Pearl and I went out to Summit View, and I've actually been several times now. They have graduations every month, and so I have been a wonderful champion for those graduates, the youth that are they're either graduating high school or some other type of GED program or whatnot that they provide within the system. And I'll have to go back and look, but I thought Dr. Kim and but that was a little while ago that we went out and toured the facility as the council. But they're very welcoming, Lori. So if you'd like to do another one, we could schedule, and anyone else who would like to go. I'll have Tiara send out an email of interest. And then if you guys want to go out, they really run a great program out there. And they do have needs as well. So Lori, I would think though, with the juvenile justice, I would think if we can send an invite for them to come back and do the follow-up. I don't think we'll be able to hit it for May. But also I'd like us to see some of that data, you know what I mean? And be prepared for them.
Yes, I agree. I think when we're talking about even with the school program, is that I have a concern that when youth are admitted to that program for 2 weeks, they're not allowed to go to school. And it's like, well, why? And that's concerning.
Yeah.
And I've never gotten an answer about why they are not allowed to go to school and they have to wear orange jumpsuits as if they were in a men's prison for those 2 weeks. That's really concerning when it comes to the mental health treatment of youth in these facilities.
Yeah, and I don't know if you recollect or not, but when Dr. Kim and I gave our overview of our visit, um, one of the most striking things that came out of that as well was um, their reporting that um, over 70% of the youth upon intake are um, in psychosis. And so we're unsure like how they enter Summit View, like if they're being held like at the detention center or the juvenile center, but upon admittance into Summit View, it is a high rate of psychosis and whatnot. But again, I don't want to take up a lot of our time because that's not on our agenda today, but I would love to do that follow-up conversation maybe at our meeting after May.
So one thing that might be helpful here is that we do fund UNR to do some of this work with DCFS and their facilities. And it's actually the same group with Dr. Greenwald and her team up there. So if we're going to have them come and talk about MTSS, perhaps we can invite DCFS and, Dr. Greenwald and her team to talk about PBIS, their program and the juvenile justice programs too. And just have one big conversation with her.
Yeah, I think that would be very helpful.
Yeah, if it's the same people. Okay, that's fine. And then also for our council, Governor Lombardo did propose allocating about $12 million to Summit View to kind of restructure their intake system and really support these kids. And unfortunately, the legislature failed to fund that.
Yeah, that is sad because as a mental health therapist, you would never admit a child to Summit View that was actively psychosis because that program is not designed for that. So that's concerning as well.
And maybe after that, yeah, no, and maybe after that next presentation, because I mean, at this point, we're unsure if they can make it for May or a subsequent meeting. Yeah. We also, as council members individually, have the ability to advocate for these things. So I don't know who's familiar with the Nellis system for the legislature, but you can go in and track things. And I'll Tiara, I'm going to be sending you an email with a bunch of stuff. One of those will be a link on how to utilize Nellis. And that's where you can track committees as BDRs or laws are coming forward into next session. You can track them there. And I think that was kind of going to help us with the purpose of that legislative subcommittee later down the road. Is helping organize our council members who are interested in providing public comment and support for measures, not just that the state wants, but that we know that Nevadans need.
Okay, great. Well, thank you to both of you. Thank you.
Thank you, Lori. Okay, so I will just start with that, I guess, Shannon, and then if for any reason they cannot present at our May thing, then just let us know. And but is there any? Oh, hold on, let me check. Oh, we got. Wait, do I have hands up? Sorry, guys, I have to jump in another thing to see hands. No, I don't see any hands. Okay. Does anyone else on that from that list that Shannon gave? Do you guys have like another hot topic area that you would like us to hit? Like, because as you know, we don't meet always every single month, and if for any reason they can't come in May, is there something else on that list that you guys would like to prioritize a conversation about? I know transportation is always a hot one. Okay, well, I'll take the lack of silence as complicit bias that if they can't present in May, then Ariana and staff and I will come up with what we'll do in May, pending that presentation. So, okay, well, I think with that, that closes out agenda item number 6, Ariana.
Fabulous. Thanks, Anna. Thanks, VC Vice Chair. Okay, sorry. Just wanted to make sure I got my acronyms right. All right, so we will move on to agenda item number 7, which is about the nominating committee. So just as a reminder for folks, we did vote on this at our last meeting, and we have 2 folks who are going to join Anna and I on this nominating committee, Montana and, oh, I'm just looking at Sarah, right? Just had it up in a minute. Yes, Montana Miller, no, and Crystal Hales, sorry. Just wanted to give folks just a little bit update on that. So we do have folks that are there. Right now, I believe we only have a handful of vacancies. So we haven't met as a nominating committee yet. And we're going to continue to treat that committee. The committee will meet as needed just to make sure we can continue to recruit and fill up the board. I believe there was a flyer that was recirculated as well, right? So if folks can continue to share that with folks so we can fill up the board, we will be working on that. But any other questions or comments here on the nominating? All right, then I will keep it moving. Next up is our data subcommittee. So again, as folks remember, we talked about this in January. And you're experiencing fear, right? It's hard to get a lot of stuff done, and for us to dig into things at a real like deeper quality level. So we really rely on our subcommittees to do a lot of that work. We also are dealing with, some capacity challenges in terms of our ability to have enough staff to support our committees. So we have prioritized the data subcommittee as one of the committees this year that will meet regularly. I believe Anna or Tiara or Shannon, correct me if I'm wrong, but I believe what we need to accomplish here today is we need to nominate a chair so the data subcommittee can start meeting. We already asked for folks' preferences, and I was trying to find that. I believe we had about 7 people that volunteered to be on that committee. What we need is for a chair to be nominated to kick off the process for somebody to start working with Tiara and staff to schedule it, create an agenda and move it forward. Yeah, Anna.
I believe I mentioned it at the last meeting, but I did want to nominate Dr. Pearl Kim because her and Lori have been 2 of the longest standing members fighting for that subcommittee. And Dr. Kim does accept that for the record.
So Anna, we lost the last little bit of that. I think you actually got that on.
Oh, I was
Dr.
saying
Kim
that
accepted.
She accepts the nomination from me.
Excellent. Any other ideas or suggestions for a nomination of a chair for the data subcommittee? If not, happy to entertain a motion for us to vote on our one nominee, Dr. Kim. Would you chair?
Anna Binder, for the record, I'd like to make a motion to accept Dr. Pearl Kim as the chair of the data subcommittee.
Lori Kiris, I second that.
Beautiful. Any discussion? Oh,
Thank you, Anna. Yeah, for the record, this is Pearl Kim, and thank you, Anna
there we
Bindery, for trusting me and then nominating me consistently. Thank you, and I will do my best to support BPAC with as a chairman of the data subcommittee. Thank you.
beautiful. Thank you, Dr. Kim. Glad you're here to accept. just happened? Oh, sorry, that was weird. I got on hold. Okay. So all those in favor of electing Dr. Kim as the chair of our data subcommittee, please raise your hand. Okay, I see 10 hands. That's everybody. Okay, everybody can lower their hands. Anyone opposed can raise their hand. Not seeing any hands, and any abstentions. All right, congratulations, Dr. Kim. It was unanimous. You are new chair of our data subcommittee. So I believe next steps, Tiara, then you can get in contact and we can start looking at scheduling stuff. Congratulations. All right, we'll keep it moving. Oh, we're being very efficient today. I thought we would take all 2 hours, but we're pretty close to wrapping it up. Okay. So we already talked about adding a couple things to our next May meeting regarding the strategic plan. For agenda item number 9, just open it up again to the council. If you have any recommendations for future agenda items, this can include specific topics you want to cover in the strategic plan, as we just discussed. Otherwise, you can trust me and Anna and the dpbh.nv.gov. It's a new acronym I've got to learn, right? Staff to support us in developing some additional agenda items. But if you have any, Lori, I think gave a great example. If you have any specific presentations or organizations that you'd like to hear presents in a future agenda, now's the time to make that suggestion. Anna.
Sorry, thanks, Madam Chair. Is Shannon still with us? I had another question. Is there, other than what she just presented to us today, are there any other laws, or are there going to be any BDR requests from the department, or is what we got the presentation on it for this session?
Thank you for the question, Anna Marie. Shannon Bennett for the record. All of that stuff will be announced as we get closer to session. I have to wait for the governor to do his state of the state and all that stuff before any of the details emerge.
Okay. Wait, when is that? You know?
January, right before session starts.
So like 3 weeks before session starts. Okay, awesome. Thanks.
All right, any other suggestions, questions, comments for future agenda items? Planning future agendas. Yes, Jamie.
I would love to see, but I think it was Shannon who mentioned the plans for peers and the facilitation of Medicaid billing through community-based agencies. If we could get a co-presentation between Medicaid and DPBH so that we could better understand what that will look like, because that is such a large piece of the puzzle when it comes to the strategic plan. I think that will really help our community agencies better understand the flow and the process in the future.
Thank you for that, Jamie. Shannon Bennett for the record. I appreciate that. We still have some things to work through with Medicaid, and we're developing a funding model. Like, we want to write it all down, because there's going to be situations, as you all know, where Medicaid won't reimburse because they have a criminal background or whatever that is prohibiting them to get reimbursement. So we want to write all this down. And then we're going to have a community meeting. I'm happy to bring it here, obviously, but we are going to host like a webinar to talk about that with all of our funded agencies, because we're going to have to develop a transition plan for when we will be requiring Medicaid reimbursement and no longer being able to pay for those services from the grants. So I don't think we're quite there yet. I would hesitate to put it on May because I don't think we'll be ready. We need to make sure us and our partners at Nevada Medicaid are 100% in sync with all that stuff, and we want to get it all written down. But if you would be open to it, we would love to keep it on the table, and then we'll tell you when we're ready. I really think it'll probably be later on this summer. And like I said, there's going to be a webinar too that we will host. We've hit some bumps and some snags, and I think it's taking a little longer than we wanted it to, right? So.
Thank you, Sean. Thank you, Jamie. Yeah, great idea. Yeah, so again, for folks too, if we can't make it for the next meeting, just encourage council members to bring it up. Ask, you can't hurt to ask, and if we can find a way to turn it into an agenda item and have people present, we will. If not, it will be in the minutes, so we can always continue to revert back and see what we've missed and how we can use those.
And Madam Chair, you guys don't have to wait until our next meetings. You can always send an email into Tiara and she'll circulate it appropriately.
Thank you. Okay. Well, if there's no other questions or comments there, I'll keep us moving to agenda item number 10, which, as promised, is your second opportunity to engage in a public comment. So again, no action can be taken under a matter raised under public comment unless the matter itself has been specifically included on the agenda item as an action item. For folks who want to provide public comment on the phone, you can dial into 775. I don't know why I have to read this. If you're on the phone, you can hear it on the phone. Anyways, okay. Dial 775-321-6111 for the conference ID 930-610-427#. Comments are limited to 3 minutes per person. So if you'd like to make a public comment and you're joining us on Teams, you can raise your hand. And if you're joining us by phone, I believe you just have to press star 5, star 6. One is to mute, one's to raise your hand. Anybody want to make previous comments? Any hands? Any hands? I am not seeing any hands. So with that, everyone's going twice. I will bring us to agenda item number 11. Oh, yes, Lori.
You know what? I just wanted to say and acknowledge Tiara for all of her help and support and all of this logistic stuff. You know, you've always been a real big help to me. So, Tiara, I just want to say thank you so much.
Thanks, Lori.
Thank you, Lori.
Use of a public comment. And now it's in record. Thank you. I'll second that. All right. Anything else? Oh. Well, thank you, everybody. Thank you, Shannon, for the presentation and answering all our questions. Thank you, Tiara, obviously, and staff for helping support us logistically. And thank you, fabulous EPAC members. You guys were fabulous. Helping us.
Tiara raised her hand.
Yeah, I saw that. Then it went away. Tiara.
It was an accident.
Oh, okay. All right. Well, thank you all. I will adjourn this meeting at 12:17. Have a fabulous rest of your day and week, folks.
Thank you.
Bye, everyone. Bye.
Thank you so much.
Bye.